For more on this, I'm joined by Dr. Mads Gilbert, a Norwegian physician and a professor of emergency medicine at the University of Tromso. He's worked in Gaza and trained junior doctors for the last 20 years and joins us now from Beirut. Doctor, it's always good to speak to you on this news hour. We heard in that report about the dire state of Gaza's healthcare system. Many times we've said that it's on the brink of collapse or it's going to collapse, but it's really remarkable to see these physicians keep going day in and day out. And is this also due to the fact that Gaza's experienced so many conflicts over the last few years that the healthcare sector has been able to adapt to it somewhat?
Absolutely, you're right. Gaza has experienced not so many conflicts, but so many Israeli attacks over the last 16, 17 years, combined with a ruthless siege which has been hitting the medical system in particular. So the colleagues, the doctors, the nurses, the paramedics, and not at least the medical student and the nursing students have been very hard trained in finding solutions under hardship. And for the last 8 months, it has been beyond descriptions the kind of attacks that they have been exposed to by the Israeli occupation forces. So you're absolutely right. What we are seeing is a small army of very heroic healthcare workers who do not give up. And it has not been noted by the media, but in fact, the Minister of Health in Gaza has been able to reopen a partial function in the hospitals, both in Al-Shifa, where they have reopened hemodialysis for the renal patients. They have reopened operation rooms in the Indonesian hospitals, and they have reopened partially function in Nasser Hospital, just to show the strength and the resilience of the Palestinian healthcare workers. On the other hand, we have the ruthless killing of almost 500 Palestinian healthcare workers by the same occupation army. And recently we heard the sad news and the very, very upsetting news that two of my colleagues, Dr. Iyad al-Rantisi, was tortured to death in a concentration camp on the Israeli side. And previously, Dr. Adnan al-Barash had the same fate. So the Israeli occupation army is ruthlessly killing, torturing, and imprisoning more than 100 Palestinian healthcare workers. So to have a healthcare system working under such difficult circumstances should be given the greatest respect and admiration from our side.
Yeah, absolutely. Doctor, I'd like to get your opinion on how these recent stats from the UN says that 67% of the sanitation and water facilities have been destroyed in Gaza. Now, that coupled with the rising temperatures, the infrastructure collapsing, so you're seeing more rubbish tips coming up all over the enclave. I would think that this would also contribute to the spread of infectious diseases. So if Gazans aren't going to be killed by Israeli airstrikes, there's the concern of infectious diseases in Gaza as well.
You're absolutely right. It's not only a concern, it's a proven fact that the watery diarrhea and vomit is paramount among, in particular, children and women. The infectious skin diseases like lice and infectious with bacteria and hepatitis A, it's all exploding in Gaza. And this destruction of the sewage cleaning systems, the water pipeline system, and the garbage removal system are all intended by the Israeli occupation forces to create a massive public health disaster. And I cannot comprehend that we are sitting now on the 9th month of this unfolding public health disaster in Gaza, and it is allowed to continue. What is the world waiting for? People are dying every day now from completely curable diseases and from complications from the wounds that they sustained during the Israeli bombing. And there is nothing being done to stop Israel. I cannot understand it. And I think that the blame and the complicity lies, of course, in Pentagon, in the White House, and in the European governments not lifting a hand to stop the Israeli onslaught in Gaza and the destruction of the civilian society.
Yeah, it's something that so many of us are finding so difficult to comprehend, as you say, as this war continues. Doctor, you described there some of the physicians in Gaza who have experienced firsthand torture, like you say, from Israeli soldiers. And I'm wondering then, how do physicians in Gaza cope with their own emotions through all of this, where they are Gazans themselves, they may have lost family members, and every day they are dealing with horrific injuries and having to treat people without anesthetic or having to treat young children. This must be something very difficult on an emotional level to comprehend and to deal with, not just now, but in the future too.
Well, I think you should address that question to Palestinian doctors and ambulance paramedics and nurses. I am a white physician from Norway. I'm lucky to be able to leave Gaza and to go home to my safe environment. But I've been working in Gaza during Israeli attacks in 2006, 9, 12, and 14. And I know the hardship, or partially know the hardship. But this double stress on the healthcare workers in Gaza, as you described, on one hand, you have to manage a massive influx of patients with very limited resources and ongoing bombing. And on the other hand, you are at risk of getting killed, arrested, or tortured, or losing your family. This is an enormous stress factor. But I think, you know, talking to my Palestinian colleagues, and I just talked to one at the conference here in Beirut today, a young, very gifted Palestinian medical doctor who worked in Shifa until the first evacuation, who was in the Baptist hospital during the bombing, who is educated in Gaza, a very clever doctor, and he is very strong. He led one of the sessions today. He is, of course, very much in grief over the losses, but at the same time, he is working for a greater cause. He is working for the greater cause of having democracy, of freedom, of getting rid of the Israeli apartheid and having a free Palestine. And that by itself ignites him so much that he can tolerate the stress that is put on him by the Israeli occupation forces. So I think we have to understand that the Palestinian sumud, or steadfastness, is a very strong virtue of the Palestinian people. And those who think that they can eradicate the resistance in Palestine, they can just forget about it. Palestine will persist, and Palestine will continue to resist occupation, colonization, and the Israeli attacks. There is no doubt about that, because it's in their blood.
Resilience, unlike anything we've seen before. Dr. Mads Gilbert in Beirut, appreciate your time as always. Thank you so much.
Shukran كثير.